President Cyril Ramaphosa will be addressing the nation tonight. Consumers and business owners are expecting a relaxation of restrictions. In the past 24 hours, the National Institute of Communicable Diseases reported 12,056 new COVID-19 cases, with around 30% coming from Gauteng. For more on this, we're joined by Wits University Professor of Public Health, Laetitia Rispel. Professor Rispel, good evening, and thank you so much for your time tonight. There's now calls for a relaxation of the regulations. Some even use the basis that cases appear to be on a decline to substantiate their facts. Can we handle an easing of some lockdown restrictions?
Good evening, Bongiwe, and good evening to the viewers. Certainly, we're seeing that the numbers have come down. However, we still have very high numbers of daily infections. As you pointed out a short while ago, more than 12,000, and deaths continue to be daily deaths very high at more than 400. And you must also remember, Bongiwe, the health system remains under severe strain. And so there are lots of people, the hospitals are full, and the health workers are exhausted and quite traumatized because of all the deaths that they see on a daily basis. However, I do think that we probably, there will be a gradual easing of restrictions. I don't think, though, that we should expect a big bang approach because of the large numbers of infections that we still have to deal with. And remember, some of those infections, there's also still quite high hospitalization rates. And for those reasons, we need to have a very gradual easing of the restrictions rather than a big bang approach.
And looking at the big bang approach, the alcohol industry is hoping for some kind of a miracle here for government to allow the sale of alcohol. It's really one of those that requires some serious balancing here, especially when you look at some of the healthcare workers who are really saying that they are not having to deal with serious trauma cases since the alcohol ban.
Yes, Bongiwe, as a nation, we have a very conflicted and contested relationship with alcohol. Alcohol remains both a cause as well as a major risk factor for motor vehicle accidents, as well as interpersonal violence. And so, given the sort of situation with our healthcare system that's under strain, I think it would be unreasonable to expect that we would go back to the levels, for example, the situation that we've seen under level 1. So the president has a very difficult balancing act. On the one hand, saving lives, and on the other hand, saving livelihoods. But I think a more sort of considerate and gradual approach would be the way to go, rather than what is, I think, an unreasonable expectation of a big bang approach.
So I take it then you don't support the calls by those that are saying that just, ease the regulations at a greater scale once and for all, because COVID-19 is going to be with us for quite some time, and we need to get used to living with the virus among us, but life has to continue as it was before.
Again, Bongiwe, I think that's an unrealistic expectation. Certainly what I would expect that the president would say tonight would be a sort of ramping up of the vaccinations. It has been encouraging. In the past week, we've seen that nationally we've passed the 250,000 vaccinations per day mark. And I think the Department of Health is planning to go 300,000 vaccinations per day. And I think once we at the level where the majority of people, especially those individuals at risk, have been vaccinated, we can maybe hope that we would begin to see some kind of normality. But just the experience that we've seen in other countries, because also you don't want to go into a situation where we go back to level 1 and then we have to go back again with kind of stricter conditions. So I think gradual process of easing restrictions, increasing our vaccinations, and of course business and communities have a big role to play as well in complying with the non-pharmaceutical interventions of mask wearing, washing hands, sanitizing, social or physical distancing, making sure that we actually comply with the regulations around the number of people that are allowed both indoors and outdoors. Funerals remain super spreader events. And so I think we almost need to change our attitude and say that we're caring for one another and for our loved ones if we stick to physical distancing and if we stick to smaller numbers.
And when we look at the vaccination drive, as you called then for the efforts there to be ramped up, it's no doubt, though, that the unrest that we've seen in recent days has also hurt this particular process, especially when you look at the fact that the minister announced even on Friday that over 47,000 doses have been destroyed due to the unrest. So no doubt the unrest will have an impact here of how things move forward when it comes to vaccinations.
Yes, Bongiwe. It's been a setback, not in terms of also in many areas vaccination simply couldn't continue. You've mentioned the 7,000 doses that had to be destroyed. But remember also a number of people got injured, and some of those were serious injuries. And those injuries, in addition to the pressure that hospitals face for admissions, seriously ill injuries also have to be admitted to hospitals. So it's a bit of a vicious cycle. And certainly we all have to always keep in mind the health workers who are the personification of the health system and who have to deal with the deaths that are quite traumatizing. They work very long hours. They often go beyond the call of duty. So I think we have to try and balance all of those aspects and also keep in mind the health workforce.
All right. It will really be interesting to see how the president balances all these factors as we look to hear then at 8:30 where the country is moving towards, because there is that continued concern of balancing of lives and livelihoods and how this will be impacted then going forward, and looking at the recent unrest with businesses barely making ends meet. How are they going to then be assisted going forward, especially with the looting, the large-scale looting that we witnessed in two provinces, KwaZulu-Natal and Gauteng?